In 2002, Emanuele Miraglia, the then national president of AIOP, the Italian Association of Private Hospitals, decided to invest in the training of young private healthcare entrepreneurs. It was then that Aiop Giovani was founded, and here is its history. Since its foundation, Aiop Giovani aimed at training young healthcare entrepreneurs in Italy by creating a place to share experiences, compare different university backgrounds, communicate, and give birth to new ideas. There are 14 regional sections: Lombardy, Veneto, Emilia-Romagna, Tuscany, Umbria, Marcia, Lazio, Campania, Apulia, Calabria, Sicily, and the 2 autonomous provinces of Trento and Bolzano. AIOP consists of the owners or the legal representatives of member institutions aged less than 40 years. The national coordinator is Aderado Orta, and the 3 deputy coordinators are Renato Serioli, responsible for the north of Italy, Fabio Miraglia for the centre, and Simone Improta for the south. Since 2003, AIOP's main objectives are defined by its statute: to promote the culture of private healthcare institution as a development factor for society, promotion of the entrepreneurial culture in healthcare business, to support the implementation of the freedom of choice principles for the healthcare user's freedom of choice, to promote the adoption of clear rules to ensure fair competition, clear rules and equal opportunities, to develop the role of private healthcare entrepreneurs as an active and responsible part of economic, social and civil development and growth, the role of private healthcare entrepreneurs, to promote a debate as well as to build constructive dialogue both within and outside AIOP, opportunity to debate and dialogue. Aiop Giovani has been working hard to put these objectives into practice, and its rich history can be divided into 5 main phases: training, sharing, discovering, new communication, and solidarity. Training. During this first phase, AIOP collaborated with some of the most important universities in the country in order to build a partnership with them. SDA Bocconi of Milan for the School of Healthcare Management, Sapienza University of Rome for the Master in Public Policy and Healthcare Management, and the branch offices of Latina for the advanced course for the creation, management and control of healthcare institutions. Health ICT Observatory, created by the School of Management of the Polytechnic of Milan for the Innovation Award concerning AIOP facilities. Biocampus University of Rome for the 2nd level Master in Healthcare Entrepreneurship. Health Forum, a point of reference for all electronic healthcare professionals, institutions, companies and experts. Studio Ambrosetti for its courses on business leadership organized in collaboration with Unindustria Bologna. And CERMET, expert in the quality assessment of the healthcare and social assistance fields. Moreover, every year during the training phase, Aiop Giovani organized independent events on specific topics, specialized meetings and training seminars. Sharing. The annual conferences gave AIOP the opportunity to share information both from within its members and with famous national and international experts. The first Aiop Giovani conference was held in Berlin in 2004. The chosen topic was social budget and business ethics, and drew the attention of the members to a very important topic for the whole Italian entrepreneurial class. On Ischia in 2005, AIOP held its 2nd conference entitled The Importance of the Human Factor in Healthcare Assistance. The aim was to focus on the importance of the human being, who is the key element of the National Health Service. In 2006, the association discussed another fundamental topic: information technology in the healthcare industry. During the 3rd national conference, which was held in Rome, Aiop Giovani invited Professor Finn Borlum Christensen to speak, president of the International Network of Agencies of Health Technology Assessment and one of the most famous experts in the world. Then, in 2007, AIOP focused its attention on the world of the economists, and the Conference of Milan was the opportunity to discuss the analysis of behaviours in Italian hospitals. The fifth national conference was held in Reggio Calabria in 2008. Its title was Organisational Models for Future Healthcare, Institutional Accreditation, Joint Commission and ISO 9000. Due to the introduction of some restrictive measures specifically applied to those regions showing a deficit, in 2009 the association mainly focused on the analysis and comparison of Italian repayment plans. Then, after becoming a member of the UEHP, the European Union of Private Hospitals, Aiop Giovani went to Paris in 2010 to discuss healthcare of the future, subjective rights and general interest, comparison between international experiences. The conference saw the participation of Max Ponsier, President of the European Union of Private Hospitals, Hirotoshi Nishizawa, President of All Japan Hospital Association, Gary L. Fileman, Senior Deputy President of the Health Management and Policy Group of Atlas Research of Boston, and Anthony Hill, Director of the New Zealand Ministry of Health Planning. Finally, during its 8th national conference in 2011, Aiop Giovani focused on a widely debated topic throughout the world: healthcare of the future, the e-health challenge. Martin Curley, Director of Intel Labs Europe, Claudio Vella, the scientist responsible for the ICT Observatory of the Polytechnic of Milan, and Mauro Moruzzi, General Director of CUP 2000. Discovering. Thanks to the introduction of the so-called study tours, a series of one-week traineeships in some of the most important cities for the healthcare industry, Aiop Giovani became international. The first destination was Barcelona in 2007, a city which at that time was in the spotlight thanks to the advanced Catalan health system. The second destination was Boston in the USA on the same year. The aim was to visit the Harvard Medical School and the Massachusetts General Hospital. In 2008, Aiop went back to the US, to Baltimore, in order to visit Johns Hopkins wards as well as its training and research centers. The fourth study tour was organized in 2009 in Tokyo, Japan, in collaboration with All Japan Hospital Association. Then in 2010, Aiop went to Havana in Cuba. While visiting its most interesting centers, the association signed the first international agreement, Historiador, whose relations with the Cuban embassy in Rome are being developed. The aim is to follow specialized Cuban doctors to work in Aiop hospitals in Italy. Finally, in 2011, Aiop went to London for the first time, where a heated debate on the healthcare reform was taking place, and then to New Zealand, thanks also to the collaboration with its embassy in Rome. The aim was to visit the most important hospitals and universities of Auckland and Wellington, and to appreciate the extraordinary and remarkable use of information technology in their healthcare industry. All of these international experiences have led Aiop Giovani to be widely recognized as an efficient and qualified player. New communication. Aiop Giovani is, first of all, a group of friends who have grown together and worked hard to make the association what it is today. As a consequence, in 2008, Aiop Giovani decided to join Facebook and LinkedIn to promote its activities both within and outside the association by creating its own website at www.aiopgiovani.it. In 2009, the website was completely translated into English, while recently, a remarkable update has made it available for smartphones and tablets as well. Moreover, thanks to the conference and seminars promoting an active use of information technologies in the healthcare industry, in 2011 Aiop gave birth to iAIOP. This application for iPhone and iPad is a first in allowing users to search the Aiop archive of the closest hospital. In the near future, it will also allow users to book a health assessment. As a demonstration of its usefulness, it has already been downloaded by thousands of people and growing. Solidarity. Aiop Giovani has always had a focus on solidarity. This is why during all of these years the association has been promoting long-lasting actions and taking part in specific projects. One of the most important long-lasting actions dates back to 2009 and involves Anladi, Annuliamo le distanze, or Let's Overcome Distances. Anladi is a volunteer organization working on healthcare and social projects oriented towards children living in developing countries, especially Eritrea and the Congo. Then, in 2011, when the tsunami ravaged Japan and hit a population that we had come to know and respect, Aiop Giovani and its members promoted a fundraising campaign of which the Japanese embassy in Rome was promptly informed. Again, in February 2011, a terrible earthquake hit Christchurch, one of the most important New Zealand cities and a destination of the study tour that AIOP was organising at the time. AIOP members decided to buy some sweatshirts with the slogan AIOP Giovani for New Zealand written on the front and managed to collect a total amount of €27,000. The proceeds went directly to Wellington with the association study tour and were given to St John's headquarters, the New Zealander First Aid Organisation, to buy a new ambulance. Regional experiences. Last but not least, it is important to say that the strength and success of AIOP are not only the result of its national and international accomplishments. In fact, regional projects have played a key role in the association's development. The Emilia-Romagna section, for example, was one of the first to promote meetings with scientific and institutional experts on evidence-based medicine. It also organised a CPAS-certified course for QMS auditors in collaboration with CERMET, a conference on corporate social responsibility, courses on business leadership, and signed an agreement with the University of Bologna concerning university masters. The Lazio section promoted a series of training meetings with healthcare experts and international representatives, such as the then health counsellor Augusto Battaglia, among others. The Sicilian section organised service meetings for all regional AIOP members on regulations and standards, professional funds for training purposes, the social responsibility deriving from the application of the 231/2001 decree, as well as on updating the DRG system. Finally, in July 2011, the association organised the first meeting of Teomina in collaboration with Giovani Confindustria. The event had great success at a national level and mainly focused on young entrepreneurs' leadership, present challenges and future perspectives. Over the last 9 years, AIOP members have been working very hard, sharing both their experiences and hopes. The results obtained so far make AIOP Giovani members even more enthusiastic and hopeful for the future. A future which is now in the hands of those young men who grew and trained together within AIOP itself. The national and international relations developed during these years, as well as the technical skills acquired, will enable AIOP members to further develop what the association has achieved so far. Their work will be institutionally essential in the very near future and represents a major challenge for both themselves and the future of the country.